Hello, my name is David Trimberger, and I am answering the Module 2 Discussion 1 question. Um, in regards, it's pretty much talking about how you have a patient that is currently in heart attack and they're needing to be taken to the cath lab. It says the patient's chest pain was given nitroglycerin earlier, but it was removed because the blood pressure dropped to 72/48. So, in regards to that question, pretty much you're at a catch-22. It's either you give them nitroglycerin to alleviate the pain and their blood pressure drops, and then you give a blood pressure medication to help combat everything that's going back and forth. So it's pretty much just a roller coaster of things, or you don't give them anything and you just put them on a basic IV drip until you get to the hospital where they could possibly, for starters, be in immense pain from the heart attack that they're having. They wouldn't be able to get much of a treatment. So, in regards to the question saying, how do I feel about this tactic? It's personally kind of crazy, but if it's what's going to be in the best interest for the patient, then if there's nothing else that you can do, like if you don't have any other special equipment on your rig or anything, then that's the route that you have to take. I've actually been on clinicals and have seen and heard other people who have been on clinicals where ER docs will actually do that tactic in the hospital, where it's just a roller coaster of having to keep on going back and forth. But if it's the best way to get rid of their pain as well as to possibly help them with a heart attack, then it's what you got to do. Is it overkill? Probably, but if it's the only thing that will work, then it's the only thing that will work at the time. And the rest of the question is just saying, describe your thoughts about reviewing all this information. So, I mean, yet again, if it's kind of like the only thing where you're having to go in that back and forth motion to see actually what could be able to take any effect, then that's just what has to go on. So that is my discussion question. Thank you for listening.